We do have a lot to get to when it comes to the coronavirus pandemic. Overnight, President Trump authorized the activation of the National Guard in the nation's 3 hardest-hit states, New York, Washington, and California. Meantime, there's a new case of coronavirus on Capitol Hill, where negotiations on that massive economic rescue package have suddenly stalled. Also this morning, the International Olympic Committee for the first time says it will consider postponing Tokyo 2020. Word of that came after Canada and Australia announced they would not send athletes if the games are not delayed. All this as U.S. cases of the virus have soared above 34,000 and 446 deaths. Our team has every aspect covered, starting with NBC's Gabe Gutierrez. He's at a hospital in Brooklyn, New York. Hey, Gabe, good morning.
Hoda, good morning. New York City is now an epicenter of the growing pandemic. The state has about 5% of the world's confirmed cases. The pre-screening tent behind me has seen long lines since last week, and now the numbers are soaring. This morning, doctors and nurses coast to coast tell us the situation is critical.
In some areas like surgical masks, we're virtually down to 0.
Despite government promises, they're desperate for protective gear and say time is running out.
We're about 10 days away from our public health system not being able to support coronavirus patients sufficiently for lack of equipment and supplies.
In New York, Governor Andrew Cuomo is asking hospitals to expand their capacity by 50%. The state is turning 4 sites, including the massive Javits Convention Center in Manhattan, into temporary medical facilities to deal with the expected surge of new patients. Governor Cuomo is also calling on the federal government to use the Defense Production Act to order companies to make more ventilators and masks. Right now, he says there's rampant price gouging.
There are masks that we were paying 85 cents for. We're now paying $7. Why? Because I'm competing against every other state and in some cases against other countries around the world.
On the front lines, healthcare workers say they're in dire need.
We just did another national survey of our nurses as of March 20th. 55% still say they don't have access to N95 respirators on their unit.
There's a fear of contagion. They're doing their best to protect themselves, but this virus is crazy contagious.
Dr. Michael Sack from Alabama is among those who have already tested positive for COVID-19.
There's a fear of being overwhelmed. Everyone's trying to do the right thing, but if we don't get control of this quickly, like in the next 2 to 3, 4 weeks, our hospital systems will be overwhelmed and our healthcare workers will be burning the candle at both ends.
President Trump says his preference is to not use the Defense Production Act because private companies are stepping up instead.
The concept of nationalizing our business is not a good concept.
GM, Ford, and Tesla are offering to help make ventilators. Apple CEO Tim Cook says the company is donating millions of masks, while Haynes says it's retrofitting some of its facilities to make them. 3M Corporation also says it's ramping up its production of those masks. Governor Cuomo, though, says that this state might need more than 30,000 ICU beds. Right now, we have only about 3,000. Savannah?
All right, Gabe Gutierrez leading us off. Thank you. As mentioned, overnight, the new $2 trillion coronavirus aid package was blocked by Senate Democrats on Capitol Hill. And there's also a new case of the virus there. NBC's Tom Costello's got that part of the story. Tom, good morning to you.
Yeah, good morning. So the Senate's going to try again today to vote on its version of that $2 trillion stimulus package. However, they've got a problem because now a U.S. senator has tested positive for the virus. House Democrats say that they want to have their own bill, which really focuses, they say, more on families and workers than on big business. The administration's focus, it says, is right now on pushing critical supplies, medical supplies, to cities in need. But in some of the hardest hit cities like New York, city officials say the federal response so far has been insufficient. On Capitol Hill this morning, Republicans and Democrats remained at odds over spending. Senate Majority Leader Mitch McConnell blamed House Democrats after a procedural vote on the Senate measure failed Sunday evening.
And the Speaker of the House shows up, and we're back to square one.
Nancy Pelosi firing back. Democrats want more money and better protections for affected workers and their families.
We'll be introducing our own bill, and hopefully it'll be compatible with what they discuss in the Senate.
But McConnell faces another major hurdle, with Rand Paul becoming the first U.S. senator to test positive for the virus, and several other Republican senators now in self-quarantine. All this adding to the debate over whether members of Congress, many of whom are in the high-risk category for coronavirus, should be allowed to vote remotely, which is currently not allowed.
I think it may be a constitutional reason why you should, but we could be in a position where I would certainly be in favor of it, where they could vote from a certain outside location.
And with growing concerns about a deepening recession, Treasury Secretary Mnuchin says it could be June before things start to normalize. The president's hopeful the stimulus package and pent-up demand for services like eating out will lead to a speedy economic recovery.
Our goal is to get relief to Americans as quickly as possible so that families can get by and small businesses can keep workers on the payroll. This will help our economy, and you will see our economy skyrocket once this is over.
This morning, the message to more than a quarter of the U.S. population: stay home. It all comes as more governors issue restrictions in an effort to contain the spread of the virus. The most recent, Ohio. The new epicenter of the outbreak, New York, which has seen a dramatic spike in cases due in part to increased testing.
New York State has 15 times more cases than any other state right now.
Governor Cuomo issuing a stern warning to young people who've defied social distancing guidelines.
It's self-destructive, it's disrespectful to other people, and it has to stop, and it has to stop now.
The administration says so far about 250,000 Americans have been tested, but the administration is now telling labs prioritize people who are already in the hospital when you're processing these. In addition, the administration says it's now working on a test that it says should be able to provide results within 45 minutes. It's hoping that test will be out by the end of the month. Hoda, back to you.
All right, Tom, thank you. Governor Cuomo underscoring this point that health officials are now out with new warnings about the virus for younger Americans. And the question is, why is the toll here more severe than it has been in other parts of the world? NBC's Sam Brock is in Houston with more on that part of the story. Hey, Sam.
Hoda, good morning. As this pandemic continues to unfold, doctors here in the U.S. still trying to figure this disease out. This morning, we're in Houston on the site of the biggest medical center in the world, where they are not providing details on hospitalizations. But we do know, Hoda, in the Houston metro alone, there are at least 40 cases involving people who are 30 or younger. 2 of those cases involving kids under the age of 10.
This morning, the coronavirus proving to be unpredictable as the nation's top health experts try to pin down who's most at risk.
Now, as we're seeing weeks move into months with this crisis, we know that a lot of our initial thoughts were not accurate. We are seeing some younger folks who can get hospitalized and can also get very sick.
Information out of China initially pointed to older people being hit the hardest, but the latest CDC data paints a different picture. Patients between the ages of 20 and 54 make up nearly 40% of COVID-19 hospitalizations in the U.S., with 12% of intensive care patients between the ages of 20 and 44. What's not clear is how many of the young patients had underlying conditions, making them more vulnerable. The death rate among this younger group remains far lower still compared to those 65 and older.
No matter how young you are, if you have an underlying serious medical condition, you're going to potentially get into trouble. But if they don't have underlying conditions, that will be something we have to really examine as to why we're seeing it here, but we didn't see it in China.
He's fighting for his life.
Zachary Baron Shemtov's husband, David, was hospitalized after he became sick. A week later, and the 44-year-old who has asthma is now on a ventilator.
Just taking it, day by day, hour by hour.
College students who packed beaches and bars over spring break widely criticized. Now, a Florida university says 5 of its students have tested positive after returning from vacation.
Young people can get it. You will get sick.
New York's Governor Andrew Cuomo noting more than half the cases in the state are people between 18 and 49. A country relying on a younger generation to be responsible, reeling at the prospect that they too could be at risk.
And as a doctor told me, there is no textbook for the coronavirus and how to handle it. They're figuring this all out in real time. Now, here in Texas, Dallas has issued what they're calling a shelter-in-place order. That takes effect later tonight. So far, the state's governor has yet to extend that order for the entire state. Savannah, back to you.
All right, Sam Brock in Houston for us. Thank you. And we're joined now live by U.S. Surgeon General Dr. Jerome Adams. Dr. Adams, good morning. Good to see you again, sir.
Good morning, and it's really I didn't expect that I'd be on the Today Show for such a somber occasion. I want America to understand this week it's going to get bad, and we really need to come together as a nation. I heard the stories that you were just playing, young people out on beaches. We see here in D.C. that the district set up a cam for people to watch the cherry blossoms. You look on the cam, you see more people walking around than you see cherry blossoms. And this is how the spread is occurring. And so we really need everyone to stay at home. So you don't think people are taking it seriously? I think that there are a lot of people who are doing the right things, but I think that, unfortunately, we're finding out a lot of people think this can't happen to them. When you look at what's going on in New York, and we said this at the beginning of our 15 Days to Stop the Spread initiative, that the numbers you see reflect what happened 2 weeks ago. We don't want Dallas or New Orleans or Chicago to turn into the next New York, and it means everyone needs to be taking the right steps right now, and that means stay at home.
Yeah. I hear the urgency in your voice, sir. I wanted to ask you, actually, because the president tweeted just last night around midnight, and he said, and I can put it up on the screen, "We cannot let the cure be worse than the disease. At the end of the 15-day period, we will decide which way we want to go." What does that mean?
Well, it means that our 15 Days to Stop the Spread initiative really was based on the fact that when it came out a week ago, we were about 2 weeks behind Italy, and we really hoped to instill a sense of urgency across America. That includes pulling down elective surgery cases, and I have a op-ed about that. That includes our social distancing measures. Stay at home. Don't take any unnecessary travel. Avoid groups of larger than 10. That includes not teleworking. And again, there are parts of the country that are doing it, but these mitigation measures work preventatively. They work best the earlier you do them, and people are still reacting and waiting to see spread before they decide to get serious.
Well, we talked last week, Dr. Adams, and you acknowledged that it's likely going to have to be more than 15 days that we take these measures. And again, this is the hazard of trying to interpret a tweet. But it sounded like the president was at least considering ending these measures after the 15-day period when he says, at the end of the 15-day period, we will decide which way we want to go. We don't want the cure to be worse than the disease. That sounds like he's worried that what we're doing to stop it is worse than the virus itself. So where do you come down on that?
Well, Savannah, as the nation's doctor, I'm here to help America understand how we need to respond to this. And where I come down is that every single day counts. Every single second counts. And right now, there are not enough people out there who are taking this seriously. And you just see it looking in California, people on the beaches. You see it in Washington, D.C., the people out looking at the cherry blossoms. We need to take this seriously.
We've talked a lot about that graphic. Everybody's seen it now about flattening the curve. This is the effort we're all collectively involved in right now. If we're not testing as much as we could be, how will we know? I mean, what's your progress report on where we are on flattening the curve when you have places like New York State saying, we're not testing you anymore unless you come in here to the hospital? So if you're not testing, how will we know if these measures are working?
Well, that's a great question, and I had a tweet out yesterday where I pointed out last week, if you look at Monday to Friday, testing increased by tenfold. Testing is definitely significantly increased across the country. Here's the problem. We aren't testing the people who are at highest risk right now, and it's why yesterday you heard the Vice President say, and you heard me say, that we need to make sure we're prioritizing testing for our healthcare workers. We need to take care of the people who take care of the people, for people in hospitals, and for people who are at highest risk right now. But as Tony Fauci has said many times, and people have heard me say this too, everyone needs to act as if they have the virus right now. So test or no test, we need you to understand you could be spreading it to someone else, or you could be getting it from someone else. Stay at home.
In New York, the governor, New York's the place where they have the most cases right now in this country, said more than half the cases they have right now, 53%, were actually young people between the ages of 18 and 49, which of course is very different than the earlier understandings of this virus. Are young people more at risk than previously thought?
Well, so far the demography definitely seems to be very different in the United States versus in other countries that saw this hit earlier. And we're looking into that. There are theories that it could be because we know we have a higher proportion of people in the United States and also in Italy who vape. We don't know if that's the only cause, but it's important for young people to know you can get this disease. You can be hospitalized from this disease. You can die from this disease. But most importantly, you can spread it to your loved ones. And so we need you to really lean in. It's why I reached out, and I want to give a shout out to Kylie Jenner, who stepped up last week and sent out a message. My daughter and my son said, Dad, make sure you call out Lauren Gray, and I believe it's Roman Atwood, making sure we are really reaching out to these social media influencers who don't listen to the Surgeon General, who don't go to surgeongeneral.com, but are on YouTube and TikTok and need to understand, hey, this is serious and this includes you.
Yeah, I hope we're getting the message out. Doctors, nurses, and hospital staff have a message, too. They are begging for protective equipment. So far, the president has resisted invoking the Defense Production Act. He's activated it, but he's not using it yet. He's resisted that. He's not sure that's the right thing to do. From where you stand as a medical professional yourself, if doctors and nurses are begging for these kinds of equipment, is it time to ask companies, not ask, tell companies to start helping in the manufacture of this life-saving equipment?
Well, a couple of things there. These are my colleagues. These are my friends. And I'm getting texts all through the night, every minute from people. And I want you all to know, as Surgeon General and as your colleague, I will not rest. I have not rested. I won't rest until we make sure the people who are taking care of the people get what they need to stay safe. Now, you asked about the Defense Production Act. Here's the thing that people don't understand. You don't need to compel someone to do something they are already doing. We talked to 3M. We talked to Honeywell, and they are at max production. We're working with Haynes. We never would have thought, if you'd invoked the Defense Production Act, to go to a Haynes. And so we're really relying on people to do what they're doing, but you don't need to compel people to do what they're already doing. But the other important point is that we're not going to ventilate our way out of this problem. We're not going to treat our way out of this problem. The way you stop the spread of an infectious disease like this is with mitigation measures and preventing people from getting it in the first place. And so while we are focusing on supply, we also need to focus on driving down demand this week. We need more people talking about, hey, stay at home.
Yeah. All right. Dr. Jerome Adams, thank you so much. I would mention that organizations like the American Hospital Association are asking for the Defense Production Act to be invoked. So we'll see where that all shakes out this week. Thank you.
We're making sure supplies are available. If you're healthy, you still can go out and donate blood. Don't forget that.
Yes, always a good reminder, sir. Thank you so much in these busy times. Appreciate your time this morning. Hoda, we'll send it to you.
All right, Savannah, thank you. We figure it's a good time in the morning. We'll hit pause again and check in with our friend, Mr. Roker. He's got some storms he's looking at working from home again. Hey, Al, good to see your face, hon.
Hey, good to see you, too. And we're talking about right now maybe a little bit of a winter storm, even though it's spring. As we look on the radar, you'll see we've got about 6 million people impacted by winter weather advisories, winter storm warnings as this system pushes up along the coast. It's going to be rain from New York all the way up into Boston, but snow above 1,500 feet as we move into tomorrow and Wednesday. This thing pushes out. We're talking anywhere from 1 to 9 inches of snow interior New York and New England, with up to an inch of rain along the coast. And then we've got a second storm coming Tuesday with heavy rain in the Ohio and Tennessee River valleys. By Wednesday, it reforms off the northeast coast, and that could bring a little more snow, but more rain more likely, stretching from the Ohio River Valley into the northeastern Atlantic coast.